Okay, let's start with a new series where I'll be discussing about the newer things which are coming up in medicine, and as a physician you would be able to know how MD medicine thinks about these news. And let's start with the news without any delay. So first news is Costasol may reduce the risk of restenosis after carotid stenting. Carotid stenting, these are the carotids, and if there is a stenosis, significant stenosis, we go for stenting there. And Costasol is a drug that has been widely used for claudication or increasing the flow in the peripheries. I think there is some theoretical basis to this research, and it is translating into clinical data. So let's see, let's hope that it fixes it into well. Okay, then the other is Technosphere insulin and degludec insulin, non-inferior to usual care. This means automated infusion devices. It's non-inferior to prevent postprandial hyperglycemia in type 1 diabetes. Actually, this Technosphere insulin is inhaled insulin, and degludec is long-acting insulin. So they are saying that it is comparable to device in type 1 diabetes, that is a constant injecting device. They say rapid-acting insulins, if delivered through device, they also take quite a long time. They does not act very fast, but this inhaled insulin in comparison works quite faster. It goes into the blood directly from the mucosa. So this is an interesting study, and I think it's promoting this Technosphere insulin. It is currently used very seldom. Let's go to the next point. Researchers highlights RSV respiratory syncytial virus vaccine less effective for immunocompromised people. So it's according to my belief, already immunocompromised patient, any vaccination, they will not be able to build up that stronger immunity as a healthy person. So how much immunity immunocompromised person builds up is a question. Then there is an important study that interests me a lot, is higher circulating level of resistin linked to increased sarcopenia in elderly. This means, what is sarcopenia? It's due to the aging process, the muscles become weak and the strength of muscles goes down. So this might be interesting, because once we know how to decrease this resistin levels, it might be beneficial in maintaining the strength even when you are older. So this might translate into a good clinical trial. Then next is hand grip strength could be predictor of diabetes risk in post-menopausal women. So this means in older women, their husband will be able to tell, because they grip in their neck of their husband. See how much she has the risk of diabetes. So the more stronger the grip, the lesser the chances of developing diabetes. That is what I understand from this, and this is an interesting study. I don't know who did it, but this is something interesting. Then comes Trinnumab, promising to moderate to severe atopic dermatitis. Actually, since these biologicals have come to the market, I am searching for some biological that can allay this problem of severe dermatitis, because I have a lot of patients who, even after giving a lot of medicines, antihistaminics, even steroids, they have not been able to recover well from, and they are landing up in problem recurrent scenario. So maybe this could help, but let's see. Time will tell mostly. Then a study shows surge of estrogen linked to binge drinking in females. So if female binge drinks, so I don't know how it will translate into the reproductive capacity of women binge drinking, but what they say is binge drinking or drinking especially is not good for child. If you are planning a child, you should think about how much you are drinking. That's what I understand. Breastfeeding for the first 1 year reduces the risk of respiratory tract infection among infants. From times old, we have been promoting breastfeeding, and that is for the health of the child. So get a prolonged breastfeeding. Usually we say till 2 years, but at least for 1 year, so that the child is safe from the lung infections. And the other is very funny. Depression may increase risky driving pattern among older adults. So I think it's a fact. If somebody is in depression, they can be driving very riskily. It's a fact. I don't know, is there any clinical trial should be able to convince us, but it's just a fact. You don't need a clinical trial for that. What I believe. Elevated post-operative hemolysis index tied to cardiac surgery associated acute kidney injury. Now what happens is once there is a exhaustive hemolysis, then obviously the kidney have a burn, and after cardiac surgery and post cardiac surgery seen there are instances where there is acute kidney injury. So that needs to be seen, and that need to be corrected. Visual impairment due to macular edema. Added benefits of faricimab not proven in a new study. Faricimab is actually approved in Europe for macular edema post retinal vein thrombosis, but it has not given that promise that it was we were expecting. Let's see how it fares in long time. Then MSALD may significantly increase long-term risk of atrial fibrillation. Okay, what they want to say is, so it can be associated with atrial fibrillation where heart is beating irregular. So theoretically, I don't know how it will. I will be reading this, but that is an interesting finding. And recently I have seen a surge in discussion about this fatty liver, and it, I think so, have answered a lot of questions we had about cryptogenic liver failure. Most of the time cryptogenic liver failure or idiopathic liver failure reflects MASLD, what I have seen. Good to hear that. Dextromethorphan may impede collagen forming scars inside cells and reduce lung fibrosis. If that's true, it's a significant finding. Even lung fibrosis patients might get benefits, and this ILD patients, interstitial lung disease patients or lung fibrosis patients, might get some benefit out of it. Let's pray. Then let's talk about other. Oral microbiome varies with life stress and mental health symptoms in pregnant women. Okay. Then CPAP lowers the mortality in stroke and TIA in patients with sleep disorders. Patient with sleep disorders, there is a threshold where we start using CPAP, and pardon me, but I think this study might be motivated from gimmick that the companies might want to sell their CPAP machines. But I will have a look on detailed look on this to form an opinion, and that's what I suggest you. But still, I am very suspicious about this news. Then behavioral intervention reduces chronic pain in people with dialysis dependent kidney failure. Okay, behavioral interventions are actually, it's easy to write, but to give a behavioral therapy in a patient is very difficult. It's time taking. Hope these attendants of the patient, they learn how to give behavioral interventions. They should not just depend on doctors. especially in kidney disease patients. That would be a great thing.